The SANDEL Correct Medication Labeling System is designed to help prevent medication errors. Components available in the system include moisture-proof medication labels, patented color-coded flags to maximize visibility of labels, medication cups, a specimen zone, and no-roll markers. Medication errors occur because writing on labels can be hard to read. Medications often look alike and can sometimes be mislabeled. Patient care situations can be unpredictable, and distractions in the healthcare environment are frequent. In one study, 1 out of every 20 perioperative medication administrations resulted in a medication error or adverse drug event. Use of the correct medication labeling system helps comply with Joint Commission standards and the AORN guidelines for medication safety. To label medications, select the appropriate labels. Using a permanent marker, write the medication strength, expiration date, time, and other information as required. Adhere one label to the syringe. Peel the flag backing halfway and apply the other label to the flag. Peel the paper backing off the flag to expose the adhesive. The colored syringe strips will come off with the backing. Adhere the flag to the outside of the medication cup. For maximum visibility, bend the flag backwards. Peel the matching colored syringe strip off the backing and adhere it to the corresponding syringe. Labels are available for a variety of departments and facility types. Ansell offers a wide selection of standard kits, and custom labels and kits are also available. For more information or to place an order, contact our customer service team at 866-764-3327.